April 3rd. Sorry, we're a little late this morning, working on some stuff, and we have Reg Council. We're gonna do, we're gonna look at some changes that have been made to S18, go through that, and then a small change that was made to S30.
Great. Good morning, Jen Carby from the Office of Legislative Counsel. We are looking at S18. This is a strike all amendment. It's draft 1.2, just because I sent an earlier draft to Kristen and I didn't want there to be any confusion about what was what. So this is an act relating to the licensure of freestanding birth centers. And I have done it in markup so you can see the potential changes. So it starts in section 1 with the new chapter on birth center licensing. After discussion, there were no changes made to the definition of birth center. I did modify the definition of certified nurse midwife based on recommendations from the Office of Professional Regulation. So this would say that it means an advanced practice registered nurse licensed in accordance with the relevant provisions of statute who has specialized training in childbirth, newborn care, and reproductive health care services. Next change is some cleanup in the definition of licensed provider. So I added before certified nurse midwives may include advanced practice registered nurses, including certified nurse midwives. Licensed midwives, took out the separate reference there to the advanced practice registered nurses and took out the reference to doctors of nursing practice. We could do a little more punctuation cleanup there. In 2352, license and prohibitions in subsection B, birth center may be independently owned and operated by a licensed maternity care provider. And I added, or any other person who complies with the requirements of this chapter.
That's cool.
Just like magic.
Yes.
And then
And
And subsection C, a birth center shall not offer or provide, and we were talking about it yesterday as epidurals, but that seemed a little casual. So I think your point was epidural anesthesia. So I added epidural anesthesia or a cesarean delivery. Just re-lettered. And then we have no changes until I think we get to the rules. And then this is the list of, again, our lead-in language here is that the Department of Health shall adopt rules to carry out the purposes of this chapter. They shall be based on the National Birth Center Standards published by the American Association of Birth Centers, and at a minimum include provisions regarding. And I left alone the one on, because I think it was important to the committee, a requirement for written practice guidelines and policies that include procedures for transferring a patient to a hospital if circumstances warrant. But then we have a new 12 requirements for written policies and procedures for collaboration with hospitals, other agencies and facilities, and individuals to provide services to patients as appropriate, including laboratory and diagnostic services, childbirth education and parenting education support services, obstetric consultation services, pediatric consultation services, transport services, obstetric and newborn acute care in licensed hospitals, and home health care services. A requirement that the policies and procedures established pursuant to subdivision A are provided to the relevant service providers upon request, and a requirement that the birth center provide the health record of the patient or the newborn or both to the receiving service provider upon referral or transfer in accordance with applicable privacy laws. That is the language we were continuing to work on this morning.
that expanded. Any, Leslie?
So these are all internal, right? I mean, all these policies are internal. That written policies have to be on site at the place.
Right,
That's what we're saying.
the birth center must have, so the rules have to require written policies and procedures. And those may involve or be provided to these various service providers. But yes, this is not a statutory, they don't have to report them back to the legislature.
Right, or OPR or anything.
Or OPR, although, upon request.
Yeah, for sure. And one more question, if I may. Where did it go? Never mind, I'll have to.
I just, just transport services.
Yep.
I get the definition of
Transport
that.
services is, are they taking an ambulance or something else to get
So
the,
they don't have to have an ambulance.
no, they just have to
They just
have policies and
the-
procedures for collaborating
Okay, to get a
to
person.
provide
to one-
services,
okay, yeah.
including transport services,
Okay.
right?
Any other questions around this? All right.
That is it for the chapter on licensing. Then section 2 is the health insurance section, and it's actually getting simpler. So this would first just take out the reference in the section heading to home birth specifically, because this section has expanded, and just adding birth centers, then we wouldn't be mentioning hospitals or other healthcare facilities. It seemed easiest just to remove the specific reference to home births, although that was particularly relevant when the section was added to the statutes. And then really the only thing that would be happening in this section is just adding birth center to the list of where a health insurance plan or health benefit plan that provides maternity benefits must provide coverage for services rendered by licensed midwives and certified nurse midwives operating within their scope of practice and provided in various settings, and this adds birth center. And there was, I think, agreement among the stakeholders that the language had been added in subdivision 2 was not necessary. It's really incorporated in subsection A with the specific addition of birth center. And there had been talk yesterday, and we looked at adding specific language about it has to be a birth center under contract with the provider, with the insurer. Thinking briefly about our other bill for this morning, S30, which is the reorganization update of the health insurance statutes. There is a new provision in the subchapter where this section lives once it's reorganized. That would apply the language about an insurer being able to require that all providers that are reimbursing be under contract with the insurer. So it's not necessary to specifically call that out here because it's going to apply to this section by virtue of applying to the whole subchapter in chapter 107. So a little bit of a sort of, as things are moving in parallel, trying to keep track of where all the pieces land. And I did tell Blue Cross that if for some reason S30 is not moving, that I will work with her to find a way to get that language in, understanding that that is the committee's intent.
Any questions about that? All right.
Right, section 3 is the CON exemption that I have just moved. And I ran this language by the board quickly this morning by Laura, the attorney you heard from yesterday. And so instead of adding this exclusion for birth centers into this existing subsection that talks about the independent individual practitioners that made the board a little uncomfortable, this would add a new standalone subsection. And then I realized as I was writing the language that it doesn't make sense to have the exemption apply to birth centers that are licensed, because this is before they create one, before they can get licensed. So this would exclude birth centers that are proposed to be established and licensed in accordance with chapter 53. And I suppose now that I'm saying that out loud, in order to also have the exclusion from transfer of ownership, I think we can say that are licensed or proposed to be established and licensed, so that we're capturing all of that. Okay,
Change that one.
Yep. So I'll keep that one in my head for just a second. And finally, we get to the effective dates. And again, once you look at something and actually start typing the language, sometimes you realize it doesn't make sense what you were planning to do. This is in section, the effective date for section 4 on the request for federal approval. And we talked yesterday about just taking out the honor before July 1st, 2025. But then it says the agency shall submit its request for approval and the Medicaid coverage will begin on the later of the date of approval. We don't need to say that. We already told them to seek approval. So we don't need to say they will submit their request for approval. So it just says it would take effect on passage and Medicaid coverage will begin on the later of the date of approval or the effective date of the birth center rules.
Okay.
That's it.
got to do some major cleanup on it.
Again, just a question on Medicaid. Right now, it's not covered, right? Medicaid. So they're asking for approval of Medicaid to start covering.
To start covering.
For the-
Yes, births in a birth center.
Yeah.
Right. So right now it is not in our Medicaid state plan that sets out all the things that are covered.
So that's why you got shall begin
Right.
process. Yeah, okay, thank you.
Yep. Before I forget, talk much else. I'm just looking at making a couple of additional. Here. Based on things that we have discussed and I don't want to forget. And here, between 11 and 12, I thought I might be adding a 13. And then it won't say percenters. Okay. So I'm just updating the CON exemption to say excluded from the step chapter are birth centers that are licensed pursuant to chapter 53 of this title or are proposed to be established and licensed in accordance with chapter 53 of this title. That way we can capture the before and active. Did that like that?
Okay. Any questions about S18? We have it scheduled for a vote after floor today. So I just want to make sure everybody's questions have been answered. Okay.
I will send, I just made this one 1.3 with that. I don't know if you want me to put the wording change up on the CON.
Yeah.
that I just wrote. And then I'll send it to Kristen so she can post, so it will be the potential final version. All right, so this would now say excluded from this subchapter are birth centers that are licensed pursuant to chapter 53 of this title or are proposed to be established and licensed in accordance with. We could say pursuant to in both places. I was trying to not make it so repetitive, but we'll say pursuant to.
So that covers new ones and ones that are already
Yes.
licensed that are being transferred to
Exactly.
someone else.
Yes, or expanding or whatever it is that it.
Okay.
Chapter 53 deals with CON.
Chapter, this is in the CON chapter that we're making this change. Chapter 53 is our new birth center licensing.
Right. Great.
New chapter.
How many chapters are there
Chapter.
in a title? You don't have to tell me if you don't know, but,
I don't know. I mean, we often skip a number in order to save,
oh, okay, space for new ones.
save space for our future selves. Yes, and your future self.
I'll count tomorrow.
Okay.
It's for the fun of it.
Going to try to fill in all those.
Because if I'm chapter
All right.
107 out of.
So Jen also has made a very small change to S30. Let's just take a look at that and then let her get to her next place. We'll take a break and then we'll come back at 10 o'clock.
All right.
Move on with the rest of our testimony.
So. Thanks to our conversation yesterday on S30, which is an act relating to updating and reorganizing the health insurance statutes in BSA Chapter 107. I added a new third instance of amendment that will change the effective date from January 1st, 2026 to September 1st, 2025. I reached out to the stakeholders who I'd sent drafts to during this whole process, after committee yesterday, asked them to get back to me as soon as possible. There was really awesome turnaround from a whole bunch of folks, so big thanks to them. And most were fine, didn't have a preference for a date. I said an earlier date, like July 1st or September 1st. DFR asked for September 1st to give them some time to kind of inventory what they're going to need to update. And so September 1st seemed like a good compromise, and I'll work with the publisher on that. And that's it.
Right, that's it. All right, well, we're missing a couple members who had, so I'm gonna hold out voting on this. And we'll do S18 and S20, S30 after the floor today. Okay?